Valley fever affects Maricopa, Pima, and Pinal counties more than any other county across the U.S. Cronkite News reporter Natalie Tarangioli met with the University of Arizona doctor who is setting up new guidelines to detect the infection early.
These new guidelines are expected to cut down on the unnecessary medical and treatments that often happen because the fungal disease is often misdiagnosed as a bacterial one, like pneumonia. Carla Gargiulo relies on 3 inhalers and a breathing machine just to get through her day.
It's like this kind of vicious cycle that I'm kind of stuck in right now.
She was diagnosed when a CAT scan showed a 2.5 centimeter nodule on her right lung. Doctors didn't initially recognize the symptoms as valley fever.
I had a chronic cough. I was extremely tired, more tired than normal. My joints, I just didn't feel good.
Coccidioidomycosis, more commonly known as valley fever, is an infection that occurs when spores found in soil are inhaled. Dr. John Galgiani from the University of Arizona published new guidelines for treating this potentially debilitating disease.
These guidelines in many respects reinforced what we said before. They specifically ask questions. It's, if you have a patient with a certain set of symptoms, do you start an antifungal drug or not? And then there's a basis for why that answer is our recommendation.
Gargiulo says she never thought of the possibility of having valley fever, even after multiple hospital and urgent care visits, until she was finally diagnosed with an infection she will have for the rest of her life.
Can't sleep upstairs. I have to sleep down on the couch because I am so short of breath I can't even walk upstairs.
Dr. Galgiani said the best thing people can do is be aware of the symptoms of valley fever.
There really is nothing you can do at the moment other than know about it, which actually is extremely valuable.
So if you're experiencing cold or flu-like symptoms, along with joint pain and possibly a rash, you should ask your doctor to test for valley fever. Dr. Galgiani hopes to see a vaccine made available sometime in the near future. He thinks one for dogs, who are 3 times more likely than humans to become infected, could be available as soon as 5 years from now. Live in Phoenix, Natalie Tarangioli, Cronkite News.
TGen is conducting a study on diseases in different dog breeds and need help from families with furry friends to get their data. Those interested in helping with the research can submit information on their dog online that TGen may use in their study. Go to cronkitenews.azpbs.org and search valley fever to find out more on efforts researchers are taking to cure the disease and what you can do to help.